Welcome to Live Better Without Surgery. I'm Dr. Joe Albano, your guide to exploring the innovative world of regenerative orthopedics. Join me as we uncover non-surgical solutions that give you hope to move better, feel better, and live better without surgery. Let's get started. Today's topic is what? There's no cure for osteoarthritis? Enter your cousin Joey and the oil change. Do you have arthritis? Because you know there's no known cure, are you waiting for Bones from Star Trek to give you a pill to grow a new knee? Like in Star Trek 4, which is the illusion. Voyage Home, when Bones, Dr. McCoy, gave a pill to a woman on dialysis to grow a new kidney. Yeah, this could happen. But until then, what are you doing to treat it? And do you base your decision on what the medical establishment recommends and is also covered by insurance? In the Star Trek example, the medical establishment recommended the traditional dialysis. It was covered by insurance. Bones' treatment was different. It wasn't covered under any insurance plan. The doctor, Bones, wasn't on any insurance panels. The doctor, Bones, wasn't on staff at the local hospital. In fact, the doctor, Bones, wasn't on even living in that century. He was an itinerant doctor. Yet the woman grew a new kidney. She didn't need dialysis. Is there a connection between the usual outcomes, medical establishment, traditional treatments, and coverage by insurance? Is there a connection between miraculous cures, non-traditional treatments not recommended and often vilified by the medical establishment, and lack of coverage by insurance? You're going to have to be the judge of that one. For now, let's go back. I will ask you the question, what are you doing to treat your knee osteoarthritis? And do you base your decision on what the medical establishment recommends and is also covered by insurance? If you say, yep, recommended by my regular doctor, yep, covered by insurance, so I'll do it. Let's see what that looks like. And then really don't worry, because I have fallen into this trap as well. So don't feel too bad if I'm talking to you. We're going to be talking about knee osteoarthritis or arthritis, but this applies to arthritis of any joint. Specifically, again, we'll talk about the knee. So what about nonsteroidal anti-inflammatory NSAIDs like ibuprofen, Motrin, Aleve, aspirin? Recommended by a regular doctor? Always. Covered by insurance? Not covered, but it's inexpensive unless you happen to get a gastric ulcer and wind up in the ICU, or have a cardiovascular event such as heart attack or stroke and wind up in the ICU. Then it's not so cheap. Steroid injections, recommended by a regular doctor, almost always. Covered by insurance, almost always. Why? It's very cheap for the insurance company, but expensive for you due to the damage done to the cartilage in the joint. Even if you have just one of them, and if you have more than that, the damage is progressively more severe. It'll get severe enough that the damaged joint is needs a knee replacement, and that's more expensive for you. And we'll talk about that a little bit more. How about physical therapy? Recommended by a regular doctor? Hopefully, but not always. Covered by insurance? To a point. Usually you get a certain number of these per year. 20 seems to be the number. And if you want more than that, you're going to have to ask your insurance company, Mother, may I get more of these? And they will say yes or no. But strengthening the knee is really good, or the muscles around the knee is really good for a knee with osteoarthritis. And everyone with knee arthritis should do this. And then also do a home exercise program as well, in addition to this. And you don't need to go to physical therapy forever, but you do need to strengthen it forever and get in a regular habit where you're doing your exercises that you learned in physical therapy. You definitely need to get stronger, and this will decrease your pain. And there's really no downside to this treatment. How about weight loss? This is a big one, pun intended. For every pound of weight around your abdomen, there are 4 pounds of pressure on the knee. So losing even 10 pounds will decrease the pressure on your knee by 40 pounds. This is huge, pun intended, and will have a large impact on managing your knee arthritis. This is one of the most important things you can do for yourself. Is it recommended by a regular doctor? Hopefully, but Not usually. And why would that be? Because this would require time to talk to you about the importance of weight loss and why it's important. And please don't misunderstand me. I am not slamming your regular doctor. I know I was trained in this same system, and you've likely been with your regular doctor, him or her, for a long time and trust them. And this is a good thing. But they are constrained by the system of insurance in which they're working. And they have at max 15 minutes to see you for all of your problems because they just don't make any money doing this. So they don't have enough time to educate you on the importance of losing weight. Most likely, what you're going to get is this: eat less, walk more, you'll be good. Don't let the door hit you in on the way out. Okay, I'm being a little sarcastic there, but I'm not too far off. So again, don't blame your doctor for this. Is it the weight loss covered by insurance? No, of course not. Why would the insurance do that? They don't make money by paying for things. They make money by denying claims, no, delaying payments, and paying doctors less than the agreed upon contractual amount. And this really is not a lot of money. And just to give you guys some idea what happens in the insurance world, it depends on, there's different E&M codes that you would put in and submit to the insurance company. And for most visits, depends, you get anywhere from 50 to 100-ish dollars. That's just not a lot of money for seeing you, the patients, and taking all the time uh, to hopefully treat you. It's just not that much. And doctors, believe it or not, live on slim margins. How about hyaluronic acid injections? Are they, these are the rooster comb cartilage injections. You may or may not have heard about those. Are they recommended by your regular doctor? Not usually, because steroids are usually the choice, but sometimes they are. Is it covered by insurance? Sometimes. And this one is actually not bad. It doesn't damage the cartilage like the steroids do, but it doesn't provide any significant relief. If you look at the data, people can get up to 3 months of decreased symptoms without damaging knee. So that's not a bad thing. And if your insurance covers it, try it. You don't really have anything to lose with that. If your insurance doesn't cover it, it is pretty expensive to do. The data shows that people may get up to 3 months of decreased symptoms. And this is really not a bad injection to get because it doesn't damage the knee. And usually it's given in a series of 3 injections, but sometimes it's in one. Okay, we're going to get to knee replacement now. Is this recommended by your doctor? And fortunately, not usually until it's bad enough. But when it gets bad enough, after you've done physical therapy, you've had the steroid shots, maybe you've had the hyaluronic acid injections, then it's recommended. And is it covered by insurance? Usually, but let's go down that road for just a second. What does that look like when it's covered by insurance? It's subject to deductible, and nowadays deductibles are higher and higher and higher. I think mine's like $5,000 or $7,000 now, which means I pay every cent of that before the insurance will cover anything. And then there's a max out of pocket. So that may be 10 or 15 or $20,000. So if you get a knee replacement, what does that typically cost for everything? Around here in Utah, it's 60 to $80,000. You go to New York or LA, it's got to be double that. But you're looking at that much money and how much you're going to actually be paying. It's not true for every insurance plan. Maybe yours is really great and you really don't pay anything. But for most people, you wind up paying a bunch of money when it is covered by insurance. So you might say, well, I'll just wait till my knee is bad enough and then I'll get a new knee. Well, you could do that, but there is no treatment. And I will repeat, no treatment that is 100% effective. Whatever it is, doesn't matter. The knee replacement usually does work pretty well. And I said, usually, but this is not always. And I have an office full of people like you every day who have had problems with one surgery or another and don't want to have that same experience again. So they're looking for alternatives. So, what are some of these alternatives? Well, this is where regenerative orthopedics or orthobiologics comes into play. That is PRP, platelet rich plasma, your blood, bone marrow, which is from you, and that does have stem cells. And then there's also fat, which does have stem cells in that as well. Actually has a lot of stem cells and high healing potential. Is this regenerative orthopedic treatment recommended by your regular doctor? Never. In fact, usually they'll greatly oppose this. Is it covered by insurance? Nope. Why would they do that? Remember, the insurance companies don't make money by paying for things. How do they make money? They make money by denying claims. No, delaying payments and paying doctors less than the agreed upon contractual amount. We talked about the specifics of regenerative orthopedics in other videos, but this does entail PRP, bone marrow, and fat. And these all come from you. These are autologous. There's another category that's covered in our other videos, cells that are not from you, allogeneic ones. So this would be umbilical cord blood, umbilical cord, placenta, amniotic fluid, amniotic membrane. So see one of our other videos about snake oil for more details on that. All of these biologic treatments or orthobiologic treatments can help manage your arthritis symptoms. So that looks like decreased pain, increased range of motion, increased function, and can help you get back to the activities and achieve your goals. And we say that it gives you hope to help you live better without surgery. And notice I didn't say anywhere in here any of these treatments would cure your arthritis. It could help manage your symptoms with whatever these treatments we're talking about. And how does it really do that? So right now I'm specifically talking about the orthobiologics, PRP, fat, bone marrow. So before I get to that, we're going to have to go back to some basic pathophysiology of arthritis for all of you science nerds out there. For you people who are not science nerds, you can skip right through this. But basically, knee arthritis, when we look at your x-rays, we see decreased joint space, or we look at an MRI, we see problems with the cartilage. And I talk about potholes in your cartilage or just general wearing down. You can see that on knee scopes too. These really are a result of the arthritis. They are not the arthritis itself. The arthritis involves a bunch of inflammatory cytokines or proteins in your knee. And these are the bad guys in this 3-act play. So these bad actors degrade the cartilage in your knee. Cue evil laugh. They prevent you from skiing or playing tennis or whatever it is you want to do. So here's the way I think about it. So you got to know I'm from New York, okay? So what do you do when you're in New York? You call your cousin Joey and you get rid of those bad guys. Well, you can do this too. You could give him a call and he'd send over the boys and they'd give him an offer that they just can't refuse. So you leave or else. And this is achieved by flushing them out with dextrose, like calling your cousin Joey. Can't get rid of them all, but lots of the bad guys leave town because they're too afraid. So when Joey leaves, they're going to start coming back little by little. So you got to call cousin Joey up again every once in a while to let them know he's watching for them. And this is where the orthobiologics come in. They prevent the bad guys from coming back in full force. They still come back, but every once in a while in little doses. And once per year, a PRP, your blood, will help decrease these inflammatory cytokines. So another way to think about this, other than cousin Joey, is to an oil change. It's regular maintenance. It's maybe sort of like hush money. So even if your knee feels good, it keeps the bad guys down to a minimum and keeps it that way. And it's always easier for cousin Joey to get rid of a few bad guys than 100. Thanks for listening to Live Better Without Surgery. I hope you found today's discussion enlightening and empowering. Keep in mind that non-surgical alternatives can lead to a healthier, happier you. Until next time, live better without surgery.